So I think what we're seeing happening is a shift in the paradigm from the old way of thinking that this is mainly a brain problem to mainly a gut problem. And if we're looking on a deeper level for what kind of abnormalities might be going on beyond what you see in these review articles that say there's no structural abnormalities, there's no metabolic or immunologic abnormalities. Actually, what you see on a deeper level, if you take a closer look, is you see some combination of the following five things. Number one, some degree of maldigestion, either exocrine pancreatic deficiency and or brush border enzyme deficiency that leads to a decrease in breakdown of the foods that we're eating, especially carbohydrates, and that results in excessive fermentation and gas. And we're going to come back and talk about that in a minute because it's critical. A lot of people malabsorb bile acids, and that can lead to irritability and diarrhea. Then right here at the center is dysbiosis, right? A term that doesn't have a very, very clear diagnosis, although we have a definition, although we have a pretty good idea of what dysbiosis is all about. And a consequence of dysbiosis is a disruption in metabolomics, right? Having unhealthy bacteria that are then making unhealthy metabolic byproducts that are then affecting the motility, the visceral sensitivity, etc. All that is tied in with leaky gut. So this fellow that I just saw that had the giardiasis that led to IBS, he said, and I get this intermittent brain fog. Well, what's that coming from? Undoubtedly, it's coming from the hyperpermeability and leaky gut. And the other thing that goes hand in hand with that is subacute inflammation, is low levels of immune activation. Not enough to cause inflammatory bowel disease or even microscopic colitis, but enough that if you did a biopsy, you would see immune cells clustered around the mucosa. So all of these things might seem distinct and separate, but actually they're part of the same problem.